is Dr. Ancy, batch of 91, St. Anne's, Tanaka. A big hello to the whole alumni of St. Anne's. It's nice to interact with you people through this video, and this is a starting. Hopefully, we will have much better interaction with all our alumni. I'm Dr. Ancy D'Souza. I've done my MBBS and family medicine, and I am working in an Ayurvedic hospital which is owned by me and my husband. So we do mostly Ayurvedic based treatments for different diseases and problems. So today I have come here to talk to you about the hot topic COVID and post-COVID symptoms and its management. So we have heard about so many stories of people suffering from COVID, succumbing to it and recovering from it. But the people who have recovered from COVID also are suffering with many symptoms which is vague or sometimes very severe, and they do not know the cause of it, or they do not know that it is because of COVID. So there are so many problems, from our brain to our nerves to our joints to our blood to our lungs. Any part of the organ can be affected by COVID, and any part of the organ can have residual symptoms post-COVID also. Now I just want to give you 2 or 3 case scenarios so it's better understanding. First case is about a patient who came to me who had severe COVID. His lungs was very badly affected. He was in the ICU and he miraculously survived and came out of it without any problem. But his lungs were badly affected and he had developed severe sinusitis after this. So because his lungs were affected, he was having difficulty in breathing. He couldn't climb the steps, he couldn't walk fast. Even walking a furlong was a big pain for him or very difficult for him. So since in allopathy they don't have any much treatment for it, and they had given him medicines, antibiotics to come out of COVID, so he came to us to get treated for further improvement of his lung health. So what we had done was we did the investigations and found out what is the optimal way that his lungs is working, to what extent it is working, to what extent his sinus is affected, and along with counseling, certain exercises to increase the lung capacity and medication, he had very good, tremendous improvement, and he was almost 90% all right in a span of 3 to 4 months. So why I am telling you this, I cannot, instead of telling you what is the medicines you can take, is even post-COVID symptoms like respiratory distress or difficulty in breathing, to take the post-COVID care, you should consult a proper doctor. Let the doctor examine you, take the required investigations, and then give you a guidance on how to take care of your health. Many times we see so many programs where in the TV they tell boil this, drink that, drink this, or on the counter take this medicines. But taking that, doing that can be negative also. So any sort of treatment that you want to take, please just do not follow any YouTube channels or what you just watch on TV, because every treatment is not suitable for everybody. But please consult a doctor and get a proper guidance regarding your treatment. The next case scenario what I want to explain is about a patient who had come to me, a female patient around 65 years old. She had come to me with severe joint pains. She was an old patient of mine who was treated for rheumatoid arthritis, and she was completely normal for the past 3 to 4 years. So she came back thinking that she got her rheumatoid arthritis again because she was having very, very severe joint pains. So when I got her investigations done, her rheumatoid arthritis was negative. So in spite of her rheumatoid arthritis being negative, her pains were not subsiding with any sort of medication. Then when I started taking her history, she told me before this joint pain started, she had a history of cough and cold for which she went to the local doctor, and the doctor gave her medicines and she became alright. So just to rule out whether it was COVID or a simple cough, we asked her to undergo certain investigations like chest CT scan and all the other required tests. And in the chest CT scan, it came out that she had ground glass appearance, which is a classical symptom of COVID affected lung. So she didn't know that she had COVID because she didn't have much of a symptoms, but she was affected with COVID and she became alright. But the residue of that COVID affected her in having severe joint pains. So when this became clear, she was treated accordingly, medicines were given accordingly, and she recovered in a span of 1 to 2 months. So this is where the importance of consulting a proper doctor rather than listening to everybody or anybody and then taking own medication. So there is an importance in meeting a doctor and taking a right care. And for this post-COVID symptoms, I do recommend Ayurveda because it is symptom free, it is without any side effects, doesn't cause any issues, or you do not have any other side effects with it, and it makes you overall, it improves your health. It is not just one organ or one part of your body that it takes care. It takes care of your body overall completely, making you regain your complete health in mind, body and soul. And these treatments can be availed by younger children, older people, any age, at any time. So my request is to my dear friends, as we have a time restriction, we cannot, it's a vast topic and I cannot talk about everything, but this is an introduction of it. So my request to all my dear friends, all my dear alumni is that please do not neglect your health, especially ladies. Please do not keep your health as the last priority. Whatever issues you have, whatever problems you have, please take it as a top priority, and initial symptoms itself, meet a doctor and take proper diagnosis and come to a conclusion and take a correct treatment. Popping in painkillers or following whatever is told on the TV by many people is not right, because everything doesn't suit everybody. So have a great year and nice talking to you people. Thank you. Bye.